We are inside the lobby of this beautiful Patient Care Pavilion here at Good Samaritan University Hospital, and I'm joined by Catholic Health's President and CEO, Dr. Patrick O'Shaughnessy. Dr. O, what are your first impressions?
I got to tell you, it is really an incredible facility. When you walk in here, you're blown away with the warmth, the feeling of state-of-the-art care. Over 300,000 square feet in this building of clinical excellence.
It's spectacular. Do you want to take a closer look?
Absolutely, let's do it.
All right, you can come too. Let's go. We're here in the emergency department, a place very special to you, Dr.
Yes.
O. If you could talk a little bit, how important is an emergency department to the community, and why is this new building so special?
Well, you know, nearly 18 years as an emergency physician, I always say the ED was always an island of safety for the community. It's the access point for everyone to feel welcome to come in for any kind of emergency they may face, right? And what a gift and privilege to be able to have this amazing best-in-class emergency room. 75 private rooms. You know, when I was practicing back in the day, that was the biggest issue that we had. We didn't have privacy for our patients. And look at what we have now.
It's the number of bays, it's the size of the space, but also the clinical care. Good Samaritan Level 1 Trauma Center, and they have excellent trauma capabilities in this new building.
Level 1 trauma for adult services, Level 2 for pediatrics. And it's critical that you have a best-in-class facility to allow those teams to provide care in what we call the golden hour, right? It is so critically important. We have all of that. We have best-in-class technology. In fact, in this emergency room, we have 3 CAT scanners. I'm lucky we had 1 CAT scanner in the hospital when I practiced in New York City, let alone have 1 in the ER. This facility has 3 with separate X-ray as well, ultrasound, all here for ease of use and access so that we can get to the diagnostic endpoint for the patient sooner and either get them home safely, or if they have to stay with us, have them safely be dispositioned up to one of our new private beautiful rooms upstairs.
Let's go take a look upstairs at the new ORs.
Can't wait.
Dr. O, you mentioned the 16 new operating rooms. This is the waiting room, the lobby, for those families who will have a loved one in the operating rooms, and it's gorgeous. It's everything you want. It's tranquil, it's calming, it's comforting.
Yes, yeah. I think it's so important. You know, we focus obviously first and foremost on the clinical spaces, but at the same time we wanted to create warm, inviting places for our family members to come, especially when their loved ones are going through something like a procedure. It could be very nerve-wracking. And having a warm space like this where people can come, convene comfortably, dock their computer. There's private consultation rooms if they need to be having private conversation for whatever reason. And again, I think it just creates the whole dynamic of what we're trying to accomplish, which is really wrapping our arms around not just the patient, but the whole family.
How important is to have these ORs, the appropriate clinical spaces for those the highest level of clinical care?
Yeah, you know, it's a great point. And what I'm most proud of is all of our clinical members or surgeons actually were involved in designing the spaces. And we said, what makes the most sense? What do you need? And for our operating rooms, they have their DNA all over it. So literally, they're walking into environments that they helped create. So we know that will equate to even better patient and family outcomes.
And from the procedures to the continued healing, next stop we're going to take a look at those private patient rooms. We're here on the private patient rooms, and Dr. O, I think you said it best. This doesn't look like a hospital, it looks like a hotel.
Exactly. I mean, look at the feel, and actually as you look down the hallway, and you can see the way that the architecture flows so well. So it really gives a whole different feel as you go down the unit, and wait till you see the room.
Absolutely spectacular. Let's take a look.
Okay, let's take a look.
Look at this room.
Wow, amazing, right?
It's spectacular.
When you look at this room, again, the feel is more of a hotel suite. Beautiful sleeping accommodations, sleeping and chair accommodations also for family that pulls out into a sleeper, private bathroom, okay? And then the technology. You can watch and play movies, hear music, get spiritual care, get hospital information, order your meals. You could watch movies on that device, but also look at this. This is a TV bigger than in my house. 65-inch flat screen in every room, with the very latest of care AI technology so that we can always have eyes on the loved one to make sure they don't have any risks such as falls, how are things going. If they have a need, push a call bell button. We want to be responsive and be there. This gives us the opportunity to accomplish all of that.
With the design, they really did think of everything. And again, the patient was at the center of everything.
Absolutely. We could feedback from patient. And I know it's evening time, but during the daylight, such beautiful natural light. There's big glass panel windows to let in natural light, to create, again, that warm, healing environment. Really exceptional patient care here. Now we've got state-of-the-art rooms to match that same level.
All right, we're back in the lobby and joined by Good Samaritan University Hospital President, Dr. Justin Lundby. Dr. O, you had a chance to tour the pavilion. What'd you think?
It's transformational. It's transformational for all the communities that surround Good Samaritan. It's transformational for Good Samaritan, and it's transformational for Catholic Health. You know, we've always had the most exceptional clinical providers here, and now we have a building that matches their level of acumen. It is just truly beautiful. I know it's a game changer for us here at Good Sam. Dr. Lundby, what are your thoughts?
I echo everything that you said. It's going to be amazing for our staff. It's going to escalate, not necessarily the care, because the care is excellent, but the patient experience is going to be escalated from this.
Yeah, I agree. When you come in here, you have more of a feel of a warm, inviting hotel environment than a hospital. I mean, think about it, 75 bay emergency room, state of the art with the very best imaging, near and dear to me as an ED doc, right? And then, you know, as you migrate upstairs, 16 amazing best-in-class operating suites that were actually designed by our surgeons. And then upstairs, private patient suites where people can heal with their families with them in a private, comforting environment, state of the art. So truly amazing, I think, changes that have happened here. Again, to Dr. Lundby's point, to match that level of excellence in care.
It truly is remarkable, and it's been our pleasure to take you inside the pavilion over these last couple weeks. Although this is our last video, we know that the talented and compassionate staff here at Good Samaritan will continue to shape the future of healthcare on the South Shore of Long Island.